Good day, sir. My name is Arnold Galagar Manligoy. Today I'm going to discuss to you the reasons why we do not want to take the vaccines. Equitable access to safe and effective vaccinations is vital to eliminating the COVID-19 pandemic. So seeing so many vaccines under testing and development is quite promising. The Department of Health is working relentlessly with partners to discover, manufacture, and distribute safe and effective vaccinations. Safe and efficient vaccinations are a game-changing weapon. But for time being, we must continue to wear masks, wash our hands, ensure proper ventilation inside, and physically distance ourselves from and avoid crowds. Being vaccinated does not allow us to disregard caution and endanger ourselves and others, especially when research into how well vaccinations protect not only against sickness but also against infection and transmission is underway. Vaccination is perceived as one of the most effective public health measures in preventing infectious diseases in the 20th century. On the other hand, in this era, it has been viewed as risky and unnecessary by a number of people who have been experiencing negative results and negative perceptions in particular situations. Recently, despite positive preliminary results for those who have already been vaccinated, many individuals in the Philippines are still wary of getting vaccinated. Vaccine reluctance is influenced by how people perceive the advantages and hazards of vaccines. Indeed, several studies suggest that those who have believed vaccines are unnecessary and unsafe are more likely to refuse vaccinations. In fact, the individual's decisions are the most important factor in gaining the person's trust. Because some of us have weakened immune system, it should not be mandatory. In addition to the perceived advantages, barriers, dangers, and action cues, the right policies and communication campaigns are designed to increase the possibility of people engaging in health promoting behavior or especially being vaccinated.
Good day, sir. By the way, I'm Peter Mark Ciclon de los Santos. Today, I'm going to discuss the body in conclusion. Vaccination hesitation is a relatively new word used in recent studies. There are no federal regulation governing vaccine administration. Each state has legislation mandating which vaccination children must get. States with more pervasive vaccination regulation also have a higher number of exemptions for vaccine. Our conclusion is a variety of studies have conducted to investigation the reason why parents refuse or postpone are hesitant to vaccine their children. In one such study, 5.77% of parents asked had reservation about one or more children immunization. The reason given by the parents vary greatly, but they may be divided into four broad groups: religious reason, personal views, or philosophical reasons, safety concerns, and a need for additional information from healthcare practitioner are among these categories. The goal of this article is to give pharmacists and the other healthcare workers aware of the most often reported reason why parents refuse to vaccinate their children. This will make it easier for healthcare workers to deliver the knowledge and awareness that patients' families require in order to make informed vaccination decisions. Within each of the above-mentioned groups, parents exhibit a range of vaccine compliance, including postponing vaccination, refusing only particular ones, or refusing immunization entirely. Religious reasons account for the majority of total vaccine rejection, but parents who have personal opinions against vaccinations are more likely to compromise and vaccinate their children, at least partially. Parents want to do the best for their children, and hearing news of potential safety problems or that childhood illness do not pose a significant threat might discourage them from vaccinating their children. That's all.
In conclusion, the vaccines are working well against the COVID-19 as it is the best way to protect every individual from serious COVID-19 illness, hospitalization, and death according to the Department of Health. Only the time can tell if compulsory vaccination will be adopted in the country. Especially the government should always find ways to choose greater good protection in giving the effective vaccines that can generally save the people's lives in this new normal. In times of worldwide emergency, the law, the president, and the citizens should always have the right not to be forced in terms of vaccination without its good effect for health. The reasons of the people for not wanting taking the vaccines must be respected and not be obliged, as they have the right in all matters that is covered by the government.